Welcome back. There's a beautiful view on the Oregon coast, a live look outside from our In It Spanish Head Resort Hotel camera in Lincoln City. Thanks for watching Afternoon Live. Nothing can stop you in your tracks like the pain of a migraine headache. Here to share some new treatment options, we welcome neurologist Dr. Joseph Maroon. Welcome, Dr. Maroon. Great to see you.
Thank you, Anna. Great to be with you this evening.
Let's start with some basics. What is a migraine and what makes it different from a typical headache?
Surely, a migraine is a chronic neurological disorder, actually, that starts with a throbbing headache. It's usually moderate to severe. It's often triggered by various foods, wine, cheese, nuts, sometimes sound, even perfume and smells can trigger it. And it can be associated with nausea, vomiting. It's a huge factor in loss of work time and family activities.
And can people feel a migraine coming on even before maybe one of these triggers really sets it in motion?
Yes, people oftentimes have what's called an aura. They'll sense it's coming on, and the question is what to do. As a neurosurgeon, I'm very much interested in holistic or natural approaches to migraine, and I prefer to start with a combination of products called Migraleaf, which is magnesium, riboflavin, which is vitamin B2, and feverfew. These are natural compounds used over 25 years by neurologists and recommended by the American Neurological Society to take during as well as a preventive for migraine headaches.
And are there other new treatment options that are coming onto the market, either that you're excited about or that we should maybe learn more about ourselves?
Yeah, there certainly are. There are drugs called gene-related calcitonin blockers or inhibitors. They're antibodies that block the compound that causes the inflammation and the dilatation of blood vessels. These are prescription drugs and quite expensive at times, and they can be used acutely to prevent the disease. There's also electroceutical devices that use electrical stimulation to stimulate the vagus nerve here in the neck that stimulates what's called the parasympathetic system as opposed to the fight or flight or sympathetic system, which puts the brain in a relaxed meditative state without meditating. So these are a few of the new things that are available to consider for those who are having migraine.
Would something like acupuncture possibly be helpful to somebody who's battling migraines?
Well, acupuncture has been used in terms of any double-blind randomized controlled studies. I'm not sure there are any that shows that it is uniformly successful. But that clearly, and omega-3 fatty acids or fish oil is something that I've recommended for years as an anti-inflammatory agent to prophylactically obviate the onset of migraine headaches.
Okay, that's good to know that we have some, I guess, easy to access options that can help all of us even battling these at home. Dr. Maroon, what kind of sparked your interest in migraines and helping people battle them?
What kind of what now?
What sparked your interest in migraines?
Well, I've had many patients. Also, I've been dealing with sports medicine and post-concussion syndrome for 30 years, 40 years. And trauma to the brain, to the head, can result in migraine headaches as a de novo symptom. So I've been obviously constantly alert as to what I can use for my own patients to ameliorate these debilitating headaches. And I keep coming back to the natural products like Migraleaf, which is something that I use very frequently. And it's a product that you may be able to see here that is over the counter, a non-prescription, but it has magnesium in it, which is one of the drugs that are given IV. If you go to an emergency room with a severe intractable headache, the first thing they'll do is give you IV magnesium. By loading up, so to speak, on this and taking it on a daily basis, you obviate the dips that are associated in magnesium and riboflavin that result in the headaches.
What about younger people? Do you ever see kids struggling with migraines?
Yes, and unfortunately, it's another very not uncommon problem. And again, I go to the natural products like Migraine first. Meditation, if you can use that, relaxing in a dark, cool room, avoiding the triggers. 27%, 24% of patients will have food triggers, caffeine, wine, nuts, and some supplements, and also added ingredients to various processed foods contribute. So you want to keep a food diary so that you can see and learn what does precipitate it, and then take the necessary steps to avoid those products.
Yeah, that's a great idea. We've all heard lots of the health benefits of meditation, but it can be hard to start. Do you have tips for people who maybe want to start a mindfulness practice but aren't sure how to kind of get that going?
Well, if you Google mindfulness, there's hundreds of things that come up on the internet, but really it's the deep breathing. Quietly sit, fold, lie down, and take in deep breaths. Inhale so that your diaphragm goes down, your heart rate goes slower, and there's a general relaxation response that occurs. But it clearly is something that can be very effective in reducing the stress that also is frequently associated as a trigger with migraine. 21% of unemployed people, many of whom are stressed, have migraine headaches.
That makes a lot of sense. Hey, before we let you go, we briefly touched on your long career with the Steelers. I also want to talk about your triathlons. How many of these have you done so far?
I've done maybe 75, but 8 Ironman distance races, 5 in Hawaii, the national championship. So I've been very fortunate. As I said, I take a very holistic approach to myself in my training.
Wonderful. Hey, thank you so much for your time today. It was great to chat with you.
Great, Mike, great pleasure. Thank you.
We'll have more information on our website at katu.com.